Um, so Marianne asked me to talk to you about something today, a little bit about complementary medicine. And I was a little taken aback because, you go to a medical conference and you don't expect the doctor to talk about vitamins and infusions and things like that. But it's actually very interesting because I've been practicing now for over 35 years. And, when I started practice, we've had patients come in over the years and I see patients in consultation and they bring big shopping bags full of pills and powders and creams and all kinds of stuff that they pay thousands of dollars for to take care of their cancer. And I'm looking like, oh my God, what are these patients doing? And so, it prompted me to start looking into this stuff. And over the years, I actually put together my own compendium. I have about a 5.5-inch binder all about complementary medicine in oncology, in cardiovascular disease, in neurologic disease, all different things you can imagine. So I try to look at it in a little more scientific method, and I'm hoping that I can answer a couple of your questions, whether this is science, pseudoscience, or just a bunch of quacks trying to sell everybody medicine. Okay. So really there are two ways we can use complementary medicine. Complementary medicine or alternative medicine can be applied to patients for supportive care, okay, make you for anti-nausea, for energy, to make you feel better, etc. Or can it be used for active therapy against cancer? First of all, when I talk about it, when I use alternative therapy, which I do to certain patients in my practice, it's always going to be IV. Why IV therapy? Okay. Well, we're trying to replace certain nutrients, whether it be vitamins, minerals, proteins. We want to replace it in a patient that's sick. And what's our problem with many of our patients? What's your problem? Your problem is you're not absorbing the stuff, okay? You've got diarrhea, you've got malabsorption, you can't get it into your system. So taking a bunch of pills, okay, a handful of pills in the morning, a handful of pills in the afternoon, and a handful of pills in the evening, or drinking some of these powders and et cetera. One, it's not going to get absorbed. Two, my personal feeling is you're filling up your stomach with 20, 30 pills 3 times a day, and how are you ever going to eat anything when you've got that? So when I talk to my patients about alternative care, we talk about IV therapy. Now, we've used IV therapy as alternative care for a long time. Patients get iron injections. We do parenteral iron, IV iron for iron-deficient patients that can't absorb iron in their gut. So it's nothing new. Now we're just going to talk about something different. We can deliver high doses of vitamins, minerals, antioxidants directly into the bloodstream. What's this doing for the patient? Well, very briefly, cell biology tells us that the energy of a cell, and hence the energy of an organ, and hence the energy of a living being, comes from the mitochondria. That's the powerhouse. That's the engine of the cell. We've got to restore mitochondrial health to the cells. The mitochondria does not produce energy efficiently if a patient is in a sickly state. Okay? So when we give nutrients intravenously, we bypass the digestive system. We get these nutrients into the bloodstream, which then bathes the cells. And the cells are bathed in this nutrient-dense solution, and the vitamins are easily accessible to the mitochondria, and we're restoring proper mitochondrial health, or the balance of the nutrients in and around the mitochondria. And this produces optimal intracellular energy. It kind of kickstarts the production of energy and treats patients with fatigue and impaired energy. How do I do this for my patients? I use a formulation called the Myers cocktail. Okay, so Myers cocktail was, it's now been around for over 30 years. It was actually first developed by Dr. John Myers in Johns Hopkins University. And then the person who took over his practice after he retired continue to modify the solution and the treatment. It's really enhances the immune system, increase your energy levels immediately after the treatment, and can sustain this increased energy for a number of days. I've been using Myers cocktail now for some time on both cancer patients and non-cancer patients. The cocktail is composed of a solution of magnesium, calcium, B vitamins, including a very high concentration of intravenous B12. Okay, we all know B12. You can get an injection in your arm. You can take B12 now by spray, etc. But it's an intravenous B12 and vitamin C, and it's given by a slow IV push or infusion or a slow infusion to get concentrations, rapid concentrations of these drugs into the system. I also buffer this solution with a little bit of sodium bicarb, and that's because the acidity of the vitamin C needs to be buffered. The original practice in Johns Hopkins treated over 15,000 patients, and they treated patients with a whole bunch of conditions, including migraines, chronic fatigue syndrome, fibromyalgia, muscle spasms, etc., a whole bunch of things. And, you know, it begins to look like the old tonic that they sold in the Old West. You know, you buy a bunch of Dr. Myers tonic and you'll feel better, okay? But there was actually a recent controlled study, and it was conducted, well, it's a couple years old now, by Yale University. And they looked at Myers cocktail on fibromyalgia patients, okay? And they found that weekly infusions improved the quality of life of these patients, the myalgias, the painful muscles and joints improved, depression improved, quality of life improved, and it lasted even as long as 4 weeks after. Now, the study did not achieve statistical significance, but the patients clearly got better. Is it safe to use? Yeah, it's perfectly safe to use. It has a very low potential of serious side effects. The patients do get a little warm feeling when they get it. That's from the magnesium. Magnesium can also, it's a smooth muscle relaxant, so it can cause a slight drop in blood pressure. We'll also find that it improves asthma because it's a smooth muscle relaxant. Other than that, it's pretty safe to give. I've been giving it to my patients, besides my patients with fatigue from malignancy or from chemotherapy. I also have a number of patients with chronic fatigue and fibromyalgia that are getting it, and I got to tell you, they have all improved. And I have one fibromyalgia patient, for example, was on narcotics for the pain and came in with a cane, and now she has completely off narcotics, and she doesn't use a cane anymore to walk, and she has not done anything else that's different. Even her physical therapist said, "This is amazing, you got to stay on it." Again, I do believe that this is rebalancing the nutrients and minerals in your system. What's the duration of treatment? Well, I start patients on 1 to 2 a week for 4 weeks, and then as they feel better, we increase the duration for the treatments. I have some patients that can go as long as 4 or 5 weeks in between treatments. Some patients, they start feeling the fatigue creep up on them again, so we just give them another infusion. Most patients are getting it once every 2 to 3 weeks. Okay. And as a testament to this, if you have any questions on it, you can ask Mary Ann, because Mary Ann's one of the patients that gets it. And it is a very, very impressive treatment. One of the things before I want to go on is, so your doctor told you no vitamins when you're on chemotherapy, no vitamins when you're on radiation therapy. That's because typically vitamins are antioxidants. And in radiation therapy, for example, the radiation therapist will tell you no antioxidants because radiation is ionizing radiation, and it produces oxidants, and that's what helps kill the cancer. Okay? So while you're on radiation, you should not be on any antioxidant vitamins. But when you're on chemo, it's a little different story. That's because vitamins, when they act as antioxidants, only last 12 hours in your system as an antioxidant. So you can get a vitamin infusion. You can take a vitamin C pill. You could take a multivitamin. 12 hours later, the antioxidant effect is gone in your system. That's why really the proper way to take vitamins and antioxidants are not once a day, but in divided doses every 12 hours. Okay? So patients that are on chemotherapy can still get this in between treatments. All right, so let's go on to the next topic that I want to talk about, and that is high-dose vitamin C therapy. So I'm just going to talk about two topics today because we want to get moving. So one treatment for cancer that's been looked at in the past has been high-dose vitamin C. Vitamin C is ascorbic acid, okay? Now, it's an acid. That means that you can't take enough oral vitamin C to achieve the effects that I'm going to talk about. When I give high-dose vitamin C to patients, I'm giving 20 to 30 grams, sometimes 50 or 60 grams at any one time, okay? When you look at a vitamin C pill or tablet that you're taking, you're looking at 500 milligrams. So you're talking about taking 40, 60, 80 pills at once. This is an acid. What's it going to do to your stomach? It's going to blow a hole in your stomach. Okay, so then why not take it with an antacid and just take it by pills? Well, then you're not going to get it absorbed into your body, because it gets absorbed in the stomach, in the acid environment of the stomach, and you need that acidity. The history of high-dose vitamin C. In 1957, Dr. Holman published a paper about hydrogen peroxide destroyed or slowed the growth of tumors in mice. We know for the last 50 or 60 years that hydrogen peroxide is toxic to cancer cells. Great, but we're not going to drink hydrogen peroxide, right? That's ridiculous. In 1969, researchers found vitamin C would selectively kill cancer cells. Now, this is in vitro. This is not in a person. It's not in mice. This is in a test tube or in a petri dish. Would harm cancer cells without harming normal cells. Well, this is potentially a perfect anti-cancer drug. You're killing cancer cells, and you're not affecting normal cells. How does this work? It's going to work by producing hydrogen peroxide in the microenvironment around the cancer cells. How do we do that? 1970s, this thing was looked at again with high doses of vitamin C to treat cancer. Linus Pauling, we all heard of Linus Pauling. Was he a crackpot? I don't know. But he's a double Nobel laureate. He's the only guy in history to win the Nobel Prize twice for completely different topics. His first Nobel Prize was for chemistry, and he looked at covalent bonds between molecules. And he and his partner reported on clinical trials an increase in survival times with terminal cancer patients treated with vitamin C. By the time he actually wrote this, he was considered a crackpot by the medical community because he also thought vitamin C was going to cure the common cold. Let's forget about that for a while and concentrate on high-dose vitamin C. A second report was published in 1978 by the same guys, substantiating this effect. They used high-dose intravenous vitamin C for 14 days in a row, followed by maintenance oral vitamin C. That's how they did their study. The Mayo Clinic responded with a study that suggested vitamin C had no effect. Well, the Mayo Clinic, very prestigious, right? And everybody accepted the Mayo Clinic findings and said Linus Pauling's a crackpot. Well, the Mayo Clinic was a different study. It didn't do what Linus Pauling did. The Mayo Clinic gave oral doses of vitamin C. You can achieve the blood concentrations of the vitamin C that we're looking for with oral intake. So it wasn't the same study. The medical community accepted it, though, and the findings of Pauling and Cameron were cast aside. 1994 comes by. 1994, a fellow by the name of Robinson used high-dose vitamin C on cancer, on mice with cancer. Okay, they randomized the study. It was a very good study, again, not a human study, on mice, that said the mice that received high-dose vitamin C lived 20 times longer than controls. Now, you can't compare mice to men, or you can't compare apples to oranges, but you know, this is pretty significant, and if you try to translate it, it means humans could live a long time with this. So what do we know? Well, now there are reports in the NCI. The NCI and NIH is actually looking at this, okay? Vitamin C, this is taken from the NCI website, okay? NCI says, vitamin C is a nutrient found in food and dietary supplements. Absolutely, we know that. It's an antioxidant and plays a key role in making collagen. Absolutely, we know that. High-dose vitamin C may be given intravenously or orally. Well, intravenously is the proper way to take it. When taken by intravenous infusion, vitamin C can reach much higher levels in the blood. We know that. This is on the NCI. Okay? Compared to orally administered vitamin C, IV vitamin C can result in 30 to 70 times higher intravenous concentrations of ascorbic acid. Okay? These concentrations are toxic to cancer cells in culture, in vitro, okay? Now, how does it work? Well, one proposed mechanism of action is the vitamin C is converted to peroxidase. It's converted to hydrogen peroxide, okay? Hydrogen peroxide, toxic to cancer cells, right? Normal human cells have an enzyme called catalase that hydrolyzes the hydrogen peroxide and turns it into, now what's hydrogen peroxide? 2 hydrogens, 2 oxygens. Turns it into water and oxygen. That's what hydrogen peroxide turns into, okay? Tumor cells, many tumor cells, are deficient in catalase. They don't have that enzyme to metabolize it, so you're left with a higher concentration of of hydrogen peroxide around the tumor cell. And we think that may be one of the mechanisms of action. Again, here's what it looks like. This is vitamin C, ascorbic acid. That's the chemical formulation for it, okay? And vitamin C, I call it a prooxidant. It's not an antioxidant because it turns into hydrogen peroxide, which is a prooxidant, and that's how it forms, and that's how it kills cancer cells. Going back to the NCI statement now, high-dose vitamin C, this is again from their website, has been studied as a treatment for patients with cancer since the 1970s. Laboratory studies have shown that high doses of vitamin C may slow the growth and spread of prostate, pancreatic, liver, and colon, and other types of cancer cells. They state that, okay? They're perfectly willing to state that. Some laboratory studies have shown that combining vitamin C with other anti-cancer therapies may be helpful. Sometimes it can make it less effective. Okay? In particular, lung cancer. Lung cancer and vitamin C just don't go together. Okay? Animal studies have shown that high-dose vitamin C treatment blocks tumor growth in certain models of pancreatic, liver, prostate, and ovarian cancers, sarcomas, and mesothelioma. This is really incredible stuff. How many people have heard of this? Nobody, right? Okay. Okay. Some human studies of high-dose vitamin, this again from the NCI, so this is all out there. Some human studies have shown that it improved quality of life as well as improvements in physical, mental, and emotional functions. Maybe there's a placebo effect there. I don't know. Symptoms of fatigue, nausea, vomiting, pain, and appetite loss. IV high-dose ascorbic acid has caused very few side effects in clinical trials, right on the NCI website. While generally approved as a dietary substance, the FDA has not approved the use of high-dose vitamin C as a treatment for cancer or any other medical indication. We can understand that, okay? There are no clinical studies to support that at this time. What's the current data today? Okay, controlled clinical trials indicate vitamin C is safe and well tolerated in patients. There are studies that show it's safe and tolerated. There are 4 phase 1 studies, okay, with patients with advanced cancer that show that IV administration of vitamin C up to doses of 1.5 grams per kilogram of body weight was well tolerated and safe in patients with pre-screened, safe and pre-screened patients. So it's a safe treatment. Retrospective analysis of breast cancer patients reported that complementary administrations of IV vitamin C, along with their current cancer therapy, reduced quality of life related side effects. So it did help with side effects of traditional therapy. There was a phase 1 study in 9 patients with metastatic cancer, metastatic pancreatic cancer, that showed that you can safely get the doses and levels of vitamin C in the bloodstream that we're looking for in conjunction with gemcitabine and Tarceva, which is one of the standard treatments for pancreatic cancer. So it can be used, okay? And in 2015, Cornell, this is a study from Cornell in conjunction with the Cold Spring Harbor Laboratory, Tufts Medical School, and Harvard Med, published a paper that found high doses of vitamin C, okay, impaired the growth of KRAS and BRAF mutated colorectal tumors in cultured cells in mice. Again, this is the type of cancer that is susceptible to many different treatments, just as Dr. Thomas alluded to with the immunotherapy drugs, the same kind of cancer. So these types of cancers may be susceptible to a lot of different treatments, and maybe this is one of them. Okay? So in summary, the original study by Paul and Cameron in the 70s and 80s showed that high doses of vitamin C for 10 days followed by at least 10 days of oral vitamin C was helpful in increasing survival time and quality of life of terminal cancer patients. There's a lot of controversy about this. It's not a recognized treatment. Is it a possibility to use in certain patients? Probably yes. Look, this is a complex problem with cancer care. We have a lot of different targets, a lot of different receptors we can use to treat cancer patients and neuroendocrine patients. Sometimes the patient needs a respite from aggressive high-dose therapy. They need a little break. This may be something we can use as a break for those patients who don't want to continue with high-dose aggressive therapy for a while. I don't know. I'm throwing it out there. It's something that's a possibility. Can this be another piece of the puzzle for a cancer therapy? I think it might be. I think we need to do more studies. I think the government should be open to doing more studies on this. It's an interesting political, if you like politics, an interesting political tidbit. Ascorbic acid in pharmaceutical grade was available 2 years ago by 4 commercial pharmaceutical companies. 4 different companies produce high-grade pharmaceutical vitamin C to be used as an infusion, okay? Today, there's only 1. 3 of those labs were shut down by the FDA. Nobody knows why they were shut down by the FDA, but if you're interested in politics, the only one that's left functioning is Mylan Pharmaceuticals. Mylan is the company that drove up the price of the EpiPens because the CEO of Mylan is the daughter of one of the congressmen that had something to do with that. So that's the only company that's left. They jacked up the price of vitamin C by 4-fold in the last year. Okay? So I don't know what that means other than it's interesting. And my final word is that all we've got for cancer care? I don't think so. If everybody is thinking alike, then nobody's thinking, somebody isn't thinking. Patton said that, I believe it. We've got to keep thinking, we've got to keep exploring new methods and new ways to treat our patients, whether it be through immunotherapy or nutritional therapy or whatever. But we've got to keep thinking. Thank you.